Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today's episode is one you don't want to miss. If you or someone you cared about struggles with seasonal or year-round allergies, the over-the-counter medication I'm about to introduce may be useful for you or others, and that is Nasonex, one of the effective over-the-counter options for allergy-related nasal symptoms. It is a non-drowsy, scent-free nasal spray designed for convenient once-daily use. In this video, I will walk you through 5 key things you need to know about Nasonex, its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. If you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Nasonex and who it's for? Nasonex is a nasal spray that contains Mometasone, a corticosteroid. The over-the-counter formulation is approved to temporarily relieve symptoms caused by hay fever or other upper respiratory allergies, including runny nose, nasal congestion, itchy nose, and sneezing in adults and children 2 years of age and older. Nasonex has a long regulatory history. Its prescription version was first approved by the FDA in October 1997, and in March 2022, the same active ingredient and strength became available over the counter, making access easier without a prescription. Nasonex can be used for both short-term seasonal pollen allergies and ongoing year-round allergies caused by dust mites or pet dander. For patients whose nasal allergy symptoms are not well controlled with oral antihistamines, Nasonex is often a reasonable next step to consider. Second, how does Nasonex work? The active ingredient in Nasonex, Mometasone, is a corticosteroid with broad anti-inflammatory activity. It suppresses multiple immune cells and inflammatory mediators, helping to reduce swelling and mucus production. By acting directly on the nasal mucosa, Mometasone targets the underlying inflammation that drives allergic rhinitis. Patients may begin to feel relief within 12 hours after use, but the full effect may take several days of regular once daily use. Third, let's talk about how to take Nasonex. Nasonex is for use in the nose only and should not be sprayed into the eyes or mouth. If it accidentally gets into the eyes, rinse well with water. Each spray delivers 50 micrograms of Mometasone. For adults and children 12 years of age and older, the recommended dose is 2 sprays in each nostril once daily while sniffing gently. For children 2 to 11 years of age, the recommended dose is 1 spray each nostril once daily while sniffing gently, with adult supervision. If you miss a dose, do not double the next dose. Before first use, shake the Nasonex bottle and then prime it by pumping until a fine mist appears. If the spray has not been used for 7 days or longer, it should be reprimed before use. Detailed step-by-step instructions are provided in the package insert, but here are several key points. Before each dose, gently blow the nose to clear the nostrils and always shake the bottle. Since Nasonex is a suspension and needs to be well mixed. While sniffing gently, press down on the spray nozzle. You should feel a light mist in the nose and breathe out through the mouth. Avoid spraying directly on the nasal septum, the central wall between the 2 nostrils, which has abundant blood vessels and less nasal tissue. Spraying directly on the septum may increase the risk of nosebleeds without improving symptoms. Caution is advised when using Nasonex with strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, as these drugs may increase systemic exposure to mometasone. Reviewing all medications and supplements with a doctor or pharmacist is always a good idea to screen for potential interactions. Fourth, let's review the warnings and precautions. Hypersensitivity reactions, including wheezing, may occur after nasal administration of mometasone. If this happens, stop Nasonex and seek medical attention right away. Local nasal adverse events may develop, including nasal irritation, nosebleeds, nasal ulcer, and in rare cases, nasal septal perforation, a hole in the cartilage between the nostrils. These potential risks are known with intranasal corticosteroids. For those using Nasonex for several months or longer, periodic examination of the nasal lining is recommended. Because corticosteroids can delay wound healing, patients with recent nasal ulcers, nasal surgery, or nasal trauma should avoid using Nasonex until healing has occurred. Localized fungal infections, such as candida in the nose or throat, have been reported with intranasal mometasone. Patients should contact a healthcare provider if they notice redness or white patches in the nose or mouth. If such an infection happens, treatment may include antifungal therapy and stopping Nasonex. Because Nasonex contains a corticosteroid, it may affect immune system and increase susceptibility to infections. While using Nasonex, patients should avoid exposure to contagious illnesses such as chickenpox or measles. The labeling specifically highlights tuberculosis, chickenpox, and measles. If you have or come into contact with someone who have these infections, stop Nasonex and consult a doctor. Patients with eye infections should also discuss with a healthcare provider before use. When Nasonex are used at higher than indicated doses or used with other steroid medicine for asthma, allergies, or skin rash, the risk of systemic corticosteroid effects such as hypercorticism and adrenal suppression may increase. Ask a doctor or pharmacist before using Nasonex if you're taking other topical or systemic steroids. Corticosteroids may also contribute to the development or worsening of glaucoma and cataracts. Patients with a history of blurred vision, elevated eye pressure, glaucoma, or cataracts should speak with a doctor before Nasonex use. Any new vision changes should prompt medical evaluation. Lastly, as with other corticosteroids, Nasonex may slow growth in pediatric patients. Children should use for the shortest duration necessary to achieve symptom relief. Talk to your child's doctor if your child needs to use the spray for longer than 2 months a year. Children and adolescents using Nasonex should have their growth checked routinely for prolonged use. And finally, let's talk about the side effects and safety. In clinical trials of the prescription formulation involving patients 12 years and older with allergic rhinitis, the most commonly reported side effects included headache, viral infection, sore throat, nosebleeds, and cough. Most of these side effects occurred at rates similar to placebo. One notable difference was nosebleeds. In these studies, nosebleeds occurred in 11% of patients using Nasonex compared with 6% of patients receiving placebo. If you experience frequent or severe nosebleeds, stop using Nasonex and consult your doctor. If symptoms do not improve within 7 days of starting treatment, or if new symptoms such as severe facial pain or thick nasal discharge develop, this may suggest something other than allergies, such as an infection. In that case, stop using Nasonex and get medical evaluation. Overall, when used as directed, Nasonex has a well-established safety profile. And there you have it, 5 key things to know about Nasonex, a once daily, scent-free, over-the-counter nasal steroid that provides targeted relief for allergy-related nasal symptoms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.